Hi, my name is Dr. Andre Panagos. Thank you for joining me on this presentation on real, cutting-edge ways to alleviate back pain. We'll be talking about simple ways and important ways to minimize or reduce your back pain. The most important one, and I think the one that patients have the hardest time understanding, is the concept of butt pain or sitting burden. My feel is that back pain is on the rise because we sit for very, very long periods of time. Sitting for short periods of time is not a problem whatsoever. Human beings are not made to sit for long periods of time. And in the internet, there are many studies that review proper sitting posture, but none mentions the fact that we're not made to sit for long periods of time, because when we do, our posture is never good. And we basically are trying to reproduce lying down. The term we use for lying down in your chair is called sacral sitting, which puts a tremendous load on your lower back. So prolonged sitting is really, really bad. And the reason this is happening more and more is because of really the rise of computer use. Other issues that may cause back pain include genetics and smoking. Genetics is not modifiable, but smoking is. Posture is key. Remember what your mom said. You want to keep your head upright, look straight ahead. We call this back hygiene. Preferably, you like to keep your head back with your ears over your shoulders and your shoulders over your hips. This includes when you're sitting as well as when you're standing. Again, as I mentioned before, it is impossible to have good posture with sitting. And please, no slouching. Exercise is key, not only to having a healthy back, but also to have a very graceful aging process. What we don't understand or appreciate very much yet is that weakness increases with aging. The less we do, the less muscle we have. Isaac Newton said it the best in his first law of motion: a body in motion stays in motion, and a body at rest stays at rest. If we're not moving around, our bodies say, you know what, I don't need the muscles here. Let's put our energy to doing something else. So our muscles get weaker, and over decades, we get significantly weak. As we get weaker, we have greater difficulty supporting ourselves and doing normal activities that we take for granted. So it's important, if you have back pain, to consider physical therapy to motivate you to be active. When you do exercise, you really want to focus on core strengthening, because the core is the key when it comes to strength in your distal extremities. There are different ways of doing it. You can do Pilates, yoga, or gyrotonics, which is more rotational Pilates. Independently of which one you do, it is important that you do it regularly to get those muscles stronger and to keep them strong. If you've done everything possible and nothing's changed, you've overloaded your body's natural ability to heal. In this case, we need to diagnose and treat the underlying cause. Some different targeted interventions can be epidural injections, facet injections, neurotomies, trigger point injections, spinal cord stimulars, or discography. It's not that you need all of these. The big question is, which one of these will make the biggest difference to get you back to your normal life? The newest field that is very, very exciting for many people is regenerative medicine. The goal of regenerative medicine is actually to repair tissues. What is available currently is prolotherapy, which works to strengthen the ligaments that can be loosened with prolonged sitting or prolonged stretching. Nerve hydrodissection, which focuses on decreasing nerve sensitivity if it's had pressure over long periods of time. Subcutaneous perineural therapy works on the superficial fascia, which, if that's stretched for long periods of time, can cause very microscopic nerve injury, resulting in chronic pain. In the news, most recently, is platelet-rich plasma, as that seems to be done in many athletes around the world and seems to have ability to decrease pain and begin tissue repair. A more aggressive version of platelet-rich plasma is mesenchymal stem cell therapy, which focuses on taking your body's cells that work to heal tissues and regenerate tissues and placing them at the site of interest. Functional medicine focuses on the lifestyle and foods that we eat that can cause our body to break down faster or age faster, or allow our body to heal. The goal of functional medicine is to decrease your overall inflammatory load. Back pain can be a symptom of many different things, and functional medicine tries to differentiate nutritional, autoimmune, endocrine causes from other causes. And finally, don't forget a good dose of common sense. I love the quote, "Can I go outside and play?" which is paramount in small children. It's less and less paramount as we get older. But if we don't play, we age faster, because play is very rejuvenating for our soul, our physical body, and our mind. If you think of different treatments, if the basic stuff that you've done on your own has not been helpful, remember to think about less risky options first and proceed as needed. Remember to make good and informed choices. Do not solely rely on the internet for your information gathering. It's important to remember back pain means you are overloading your back for some reason. It is critical to find the cause and to treat the cause before it becomes a much greater part of your life in a very bad way. I think you can navigate the complex waters of back care if you use a good dose of common sense. Thank you very much.